Talked about OCD. Now we got to talk about the other ones. So, 23-year-old woman saw a plastic surgeon for a preoperative evaluation. Everyone told her she was quite attractive and she could be reassured for a short period of time, but she still was obsessed with the thought that her left ear was lopsided and marred her appearance, and everyone is looking at it. So she was always looking at herself in the mirror. She'd look at the reflections in the bumpers of cars, looking from different angles. She became so self-conscious that she'd recently been avoiding social events where she might meet new people. So she wants the plastic surgeon to do something about it. So this is taking us to body dysmorphic disorder. This is really a very good rendition of what it is like to have this disorder. A person looks into the mirror and actually sees something different than everybody else sees. They look in the mirror and they see a monster. So, preoccupation with an imagined defect in appearance. Notice that it excludes anorexia nervosa. You may recall that with anorexia nervosa, there's also a distorted body image. The afflicted individual actually thinks she's fat, while the rest of the world thinks she's emaciated. I should say I had a patient with this condition who was a physician. There's a physician who was doing her fellowship for a specialty, and she came in. She thought she looked hideous. She had all kinds of things about her face. She would flush easily when embarrassed, and all kinds of other things. And getting to go to work every day was very, very difficult. She was able to have one relationship, a romantic relationship with a man who moved in, but eventually his presence was just so suffocating, she had to let him go because she needed the downtime where no one was seeing her so that she could just relax without feeling that others were judging her appearance. Anyway, very interestingly, when she graduated her fellowship, she moved to Montana to practice her specialty there, again, in a place where there'd be few people to notice her defects. And she did not respond to high doses of SSRIs. So prevalence of body dysmorphic disorder, 2%. I think if you look in terms of mild body dysmorphic disorder, it's going to be much higher. I'm sure everyone here knows that when you have a bad hair day, or when you're younger and you had acne, and a new acne pimple, you'd look in the mirror and you'd be like, oh my God, everyone's going to notice this. How can I get out of the house? And yet nobody really notices, nobody really cares. So gender equivalence here. So OCD and related disorders have this interesting gender equivalence. They like to go to dermatologists and cosmetic surgeons. And very important for dermatologists and plastic surgeons to screen these patients, because they're not going to be happy with whatever treatment is given. They'll still see either the same place in their face is going to be a flaw, or they'll come up with another one. So patients believe that if they just got this thing fixed, their body they'd feel so much better about themselves. They're also very self-absorbed and have very few friends. They think about their perceived flaw for hours a day, and they can have good insight or poor insight. When they have poor insight, they can be absolutely sure that the dimple on my left cheek is noticed by everybody. Everyone thinks I'm hideous looking, and there's no doubt in that. That's a delusion. And so body dysmorphia disorder can become switched from an overvalued idea to a frank delusion. Body dysmorphic disorder is familial. People who have this say that their parents really didn't take good care of them, they were neglected. And it's really a variant of OCD, as first-degree relatives often have OCD. And this drug is somewhat responsive to SSRIs, less so than for OCD, but high-dose SSRIs can be very helpful in this condition. So you'd think that it was women more than men because of society's greater emphasis on women's appearance than men's appearance, but they're equal. And when you think of it, Men are concerned about the size of their genitals, the muscles, hair thinning, or having excessive body hair. So when you think about all that, it ends up being equivalent to the number of women who have their concerns. So they're constantly comparing themselves with others. Everywhere they go, they're checking themselves out. They spend hours grooming themselves. They're constantly seeking reassurance that they don't look ugly. And they'll camouflage, so wear big sunglasses, a hood, a hat, whatever they could to conceal their imagined defects. With acne, I've seen so many patients who pick their skins in an effort to get rid of the acne that the scars from picking the skins actually does make them look bad. Example of a self-fulfilling prophecy. They do often seek surgical cures, and again, they're rarely happy with the results. Men with muscle dysmorphia will actually use anabolic steroids, and very important to ask a man who's concerned about their physique, are you using anabolic steroids? Okay, so we talked about this. And similar levels of comorbidities as we saw with OCD, and you've got here pretty high high comorbidity with a personality disorder. But you see the rest up there. Begins during adolescence and can persist for years or decades and can be unremitting. A person can have this condition the rest of their lives. Sure, they feel rejected, they socially isolate themselves. Kids can drop out of school. I had one patient like that who didn't finish high school. Remain single because they can't tolerate another person looking at them all the time. They can have work disability because they can't go to work. Now, you can imagine with a physician, there's only two specialties in which you can go and you don't have to have contact with other people, and that's radiology and pathology. And so in those fields, I'm sure some percentage of body dysmorphic disorder. 30% attempt suicide. They are so miserable. They're in so much pain and so much distress that almost a third try to kill themselves. Let's take a little break and we'll go to hoarding disorders next.